Halloween season is one of the favorite times of the year for so many people of all different ages as they dress up in different costumes and play different characters on one of the absolute favorite holidays of the entire calendar year. But some of these efforts to make your costumes more extensive and more lifelike than ever may be actually dangerous to your body in a variety of ways. Here to talk about how those dangers may affect your eyes and your vision is Dr. Amanda Salter from the Shanbom Eye Specialists in Berkley. Dr. Salter, thanks for joining us today.
Thanks for having me.
Appreciate having you on. So, as I mentioned, these Halloween costumes are becoming a lot more realistic and have a lot more accessories than we've seen maybe in decades past. And while that's great visually, there are several dangers that come along with some of these accessories, particularly some of these masks, the eyelashes, and of course those contact lenses.
Yes, absolutely. I think the contact lenses are the one that we see with the worst kind of side effects, and that would be really the counterfeit contact lenses. So, contact lenses can be safely worn if you go see your eye doctor. If you want to do costume contact lenses, go see your eye doctor, get a prescription contact lens. Then they'll be properly fitted to your eye, and your doctor will teach you the appropriate wear and care for them. If you go to, say, a costume store or a gas station or a party store and you buy over the counter contact lenses, that is basically counterfeit contact lenses. They're not FDA approved, and they can have contaminants with toxins and germs. They won't be fitted to your eye. People often share these, which is also a very bad idea. And this is all sort of a recipe for disaster for the cornea. Worst case scenario, you can get a vision threatening permanent damage to the cornea with an infection. So I think that's the one that we kind of worry about the most as far as eye doctors during the Halloween season. But, you mentioned also masks. You want to make sure that around your eye area, things aren't too tightly fitted. And other accessories too, like, you want to make sure you're not carrying anything sharp where you're walking around at night.
Yeah, I'll always put safety first with these costumes. You may have to sacrifice a little bit of that realism, but it's better to come out with maybe a little bit less realistic of a costume, but still have both of your eyes functioning properly. Dr. Salter, also what's common are or fake eyelashes or lash extensions. Those aren't quite as dangerous necessarily on the surface level as some of these contact lenses, but there are some dangers that go along with it. So for those that want to apply fake eyelashes with their costume or eyelash extensions, what are some of the things they should be considering in order to do that safely on the night of and especially on the removal?
Yes. I think there is a way to safely get eyelash extensions. First off, you want to make sure that you're going to a reputable, clean place that is doing this all the time. And you may want to kind of patch test some of the glue on your skin to make sure you don't have an allergic reaction, because that's a common problem. And if you are getting the eyelash extensions, you want to make sure that you are keeping them clean. I would suggest some of the over the counter hypochlorous acid sprays for eyelid cleansing. That's a really good way to make sure that you hopefully don't get an eye infection while you've got the lash extensions. The same thing would go for if you're going to do your own kind of false lashes with either glue or magnetics. You again want to make sure that you're not going to have an allergy. So I think patch testing is important there, and really careful application so you don't get any glue in your eye, because that can be, like a chemical injury to the eye, and that's not a good thing either.
We're joined by Dr. Amanda Salter from the Shanbom Eye Specialists in Berkley, joining us on today's edition of the Megacast. You can find more information on shanbomeye.com, ShanbomEye.com, shanbom.eye.com, or by calling them 248-546-2133, 248-546-2133 for more information and to get in contact with the experts at Shanbom Eye Specialist. Dr. Salter, other common issues that we see with our eyes in the fall season, one of the more common are dry eye or itchy eye, especially as the wind gets colder and there's not as much humidity necessarily in the air. Our eyes can get dry, and then we try to itch them, and that can cause a number of different issues just on top of dry eye. So let's start with what are some of the common causes for dry eye among people this time of the year here in Michigan?
Yes. So this is sort of the end of an allergy season right now, and allergies are one of the things that can flare up dry eye. There are a number of really great over-the-counter allergy eye drops, and of course, if you see your eye doctor, then there are prescription options as well. So that's certainly one thing that can kind of flare up dry eye. Also, as we head into the winter, as you mentioned, there's more wind, and the cold air outside tends to be very drying, as well as once we all turn on our heat, the dry heat inside tends to be really drying. So this is a good time of year to think about a humidifier. And remember, little things make a difference, like not allowing, when you're in your car, not like aim the vents away from you. Don't allow the air to blow directly in your face. That actually makes a bigger difference than you think for your dry eye. And all year round, we're all sitting on screens. So, any kind of screen device, whether it's a computer or your phone, we tend to stare, and that dries up the surface of the eyes. We need to blink in order to spread the tears and also to pump the tears out of the glands. So, there's one really helpful computer tip. It's called the 20-20-20 rule. And that is every 20 seconds, every 20 minutes, you should take 20 seconds and look 20 feet into the distance. And I would add to that, kind of do a bunch of blinking during that time as well. And that will all help with the dry eye. There are over the counter lubricating eye drops, which are also very helpful. Not enough for a lot of people. So that's where, visiting the eye doctor comes in and finding out what is specifically affecting your eyes. Do you have an eyelid condition or a medical condition or even a medication that you're taking that could be flaring up your dry eye as well?
For those that may have some vision issues that also would be afflicted by dry eye, how does that affect them? Particularly, I think about those that are wearing those contact lenses. How does that affect them, and what should they be considering if someone is experiencing dry eye either while they're wearing or before or after they're wearing those contact lenses?
You're absolutely right. Contact lenses can definitely affect dry eye. So, basically, that's another trigger or contributor to dry eye. I would say daily contact lenses are usually the best tolerated for patients with dry eye. And they do make artificial tear lubricant eye drops that are specifically formulated for contact lenses. That's going to be a lot more helpful than just re-wetting drops or any kind of like eye wash or saline. That's also not going to be great to use. So, I would say if your eyes, a good rule of thumb in general for contact lenses is if you put your contact lens in, or if you've had them in for a while and suddenly your eye is telling you it's not comfortable, listen to your eye, take your contact lenses out. Give your eyes a break and start off with lubricant eye drops. And if that's not enough, there are so many prescription medications and in-office procedures that are now available for dry eye. But I think just listening to your eyes when you're wearing your contact lenses and giving your eyes a break, it does a lot of good.
In terms of getting your eyes checked, I mentioned earlier that some people with vision issues typically wear those contact lenses and also wear glasses. So, how often should somebody be going in to get their eyes checked to update any sort of contact lenses or glasses that they need, but also to check in on their eye health, especially as seasons change, and for those that are affected by seasonal allergies too?
Great question. So, obviously, if you ever have a change in your vision or if you're having a problem, that's always a good time to come in. But as far as just regular eye checks, typically I recommend once or twice a year, and that's going to depend on a few things. So, if you're very young and healthy and you feel that you're seeing well and you don't wear glasses, you may not need to get as frequent eye exams. Definitely by age 40, you should get a baseline complete dilated eye examination because this is when we start to see early onset eye diseases where we can pick up on things early and really have more of an impact. And, once you get to like 60, 65, you definitely want to be getting annual exams at the very least. Now, having said that, if you have an eye condition, for example, such as glaucoma, you're going to be seen much more frequently by your doctor. So, those conditions aside, I would say once a year or maybe once every 2 years, depending on your age, is really appropriate.
We're joined by Dr. Amanda Salter from Shanbom Eye Specialist in Berkley, joining us on today's edition of the Megacast. You can find more information, get in contact with them at shanbomeye.com. That's shanbomeye.com, or call them 248-546 2133 248 546 2133. Dr. Salter, another couple minutes with you today. Anything else that we should be keeping aware of in terms of our eye health this fall or as we head into the colder months of the year?
Yeah, so I think some of the things I mentioned to my patients just as good eye health prevention. We just mentioned getting regular eye exams. I think that's really critical. Also, sunglasses. So I think a lot of us think of sunglasses being important in the summer. Well, I know it's kind of gloomy in Michigan in the winter, but we do have sunny days. And a good rule of thumb, I think, is if you're squinting or if you're having to do this to shield your eyes, then that's a good time to be wearing sunglasses or a brimmed hat for protection from the UV rays. So that's all year round. Think about sunglasses.
Shanbomeye.com for more information and to get in contact with Dr. Salter and the other experts at Shanbom Eye Specialist. Dr. Salter, thank you so much for joining us.
Thanks for having me.